Ebola cases in Uganda continue to increase since the disease was identified on the 20th September.
It is 35 days today since the declaration of the outbreak. The total number of confirmed cases stand at 109. Those are the cumulative confirmed cases, of whom 30 have succumbed to this deadly disease, while 34 have been treated and have improved, and 45 are undergoing treatment. To date, 15 health workers have been infected, of whom 6 have succumbed to the infection.
Today, the Minister of Health has revealed that 6 learners in Kampala have tested positive for Ebola.
These learners attended 3 schools in Rubaga division. We have listed 170 contacts from these schools for follow-up.
These children were exposed at home. But in the process, it was initially thought they were no high-risk contacts, and they went to school. Because what happened is that the uncle who came from the field arrived at night, and they were sleeping, and of course went to hospital, and then subsequently died. These children continued going to school, but they developed symptoms. And when they developed symptoms, they were tested, and they tested positive, and that's when they were taken to isolation.
The ministry did not disclose the schools, but said steps are being taken to trace the contacts and that the schools are still open.
But we've identified the contacts for these learners, and they're being followed up for 21 days. And we're talking to the teachers of these learners.
One of the pupils is a candidate of PLE.
That he is eligible to the trial drugs, the monoclonal antibodies, and the remdesivir. Today I have been informed that all his signs and symptoms have gone down, and I am hoping and praying that by Saturday, if he turns negative, he will be discharged.
The minister has also announced that Ebola vaccination will start in the next 2 weeks.
The candidate vaccines are Oxford from the United Kingdom, Sabine from the United States of America, and Merck from the United States of America. We plan to vaccinate contacts of 150 confirmed cases. This means about 3,000 initially.
The 3 districts of Kyegegwa, Kagadi and Bunyangabo, where some of the cases were identified and put under quarantine, have completed 21 days. However, the ministry says they can only be declared free of Ebola after another 121 days.
Since there has been no secondary transmission, we believe transmission may have been interrupted. However, intensified surveillance continues in these districts for another 21 days to complete the 42 days cycle before they can be cleared.
Dr. Aceng says the ministry badly needs 76 billion shillings to fight Ebola.
Government of Uganda put $6 million through the Ministry of Health.
She says that though development partners have come to their aid, they are not giving the money.
They do not give me cash. They give me in kind.
Aceng says she would ask for a supplementary budget when Parliament returns from recess. Jingo Francis, NTV.